Okay, ladies, we can all admit to having mood swings, cramps, migraines, and anxiety during a certain time of the month, right? Although we don't admit that to our husbands. Sometimes doctors prescribe birth control pills or antidepressants for PMS. But did you know it can actually be treated naturally? Well, Dr. Stephen Hotze with the Hotze Health and Wellness Center is here to explain all of this. Good morning to you.
Good morning, Brenda. How are you doing?
Well, I'm not PMSing, I don't think.
Good. You seem very level, very sweet today.
What are some
Got you on a good day.
Got me on a good day. What are some of the common symptoms?
Well, most common features you see in PMS and what most people think about are the mood changes that occur, the anxiety, the panic attacks, depressed moods, highs and lows, the crying jags, irritability, breast tenderness, fluid retention, weight gain, and premenstrual headaches. And these can happen just before the period, or they may happen a week or 2 weeks before the period. And this usually starts at some point. It can start as early. We see some teenagers, and some women will know as the teenagers they had irregular cycles. The mother took them to the OB-GYN, and what did he do? Put them on birth control pills and then put them on antidepressants.
Because you have a heavy flow.
Right, and they're going to regulate them with the birth control. Well, the question is, what causes those symptoms?
That is the question, because not every woman suffers severely with PMS.
And that's because everybody is different, and some people make a good complementary amount of their hormones that are necessary. They're well balanced, but that balance can change after childbirth. Very commonly, women say, I was fine until I had my first baby, and after that, things went to heck in a handbasket.
But then again, there are a lot of younger women who suffer severely with this, and I hear of some women having fibroids also, having a problem with that.
Fibroids of the uterus or fibrocystic breast disease. All these symptoms, the PMS, the irregular menstrual periods, the breakthrough bleeding, the heavy clotting, the fibroids, all those are signs of estrogen dominance and progesterone deficiency.
Okay, so what we need to do is increase the progesterone.
Progesterone, day 15 through 28 of the menstrual cycle. Day 1 being the first day of the period. In a 28-day cycle, you take progesterone on day 15 through 28. And depending on your age, your size, and your symptoms, you take different amounts. And your doctor, if he understands how to use natural, biologically identical progesterone, will give you the right dose. And remember that when you have progesterone deficiency, inevitably you have clinical symptoms of low thyroid.
Okay, well, help me get to the antidepressants being able to aid a person with PMS.
Well, they don't. The long and the short is nobody has PMS because they have low levels of antidepressants.
Right.
Now, Prozac is a drug you know that is used very commonly for antidepression. The company that makes Prozac has changed the name to Seraphim. So if you take Seraphim, ladies, what you're taking is Prozac. And Prozac low levels of Prozac are not the cause of PMS. Low levels of progesterone are. So you can put natural, biologically identical progesterone in your body, balance out your hormones, and feel well. Or you can take the antidepressants, which have a host of side effects and are very addictive, and not feel any better and cause a host of health problems long term. So we'd recommend the natural approach.
All right, we've been talking about some of the side effects already. Now, if you don't take care of this and balance out the hormone levels,
it just gets worse, because as your ovaries age, they produce lower and lower levels of the hormones, particularly progesterone. So as you march through your menstrual life from, say, 13 into 50, it just gets worse. And so you ought to resolve it as soon as you have your first symptoms. So if you're a teenager, a 20-year-old, 30-year-old, and you're having these symptoms, have your doctor give you a little bit of progesterone, if needed, a little bit of thyroid. And that can level you out and you can feel great.
Is that why sometimes the birth control pills seem to work? Because of that little extra dose of progesterone?
Well, they don't contain real progesterone. They contain the counterfeits. And most women, many women will tell you when they get on the birth control pills, they get the weight gain, they get the mood swings, they get all these symptoms.
That they don't want. All they want to do is get rid of the PMS issue.
That's right. And their flow may be normal, but they have a whole host of symptoms that precede that.
I see.
So remember, the birth control pills are not natural.
Right.
They're counterfeit hormones. We always recommend that which is natural. It's always going to be better for you than that which is not.
You know, but so many of us suffer with PMS thinking that, it's just what happens, but there's something you can do.
You can do about it, and you should. If you want to feel well and remain healthy, you treat it.
All right. Thank you, Dr. Hotze.
Thank you so much, Brenda.
All right. To find out more, call the Hotze Health and Wellness Center at 877-698-8698. 698-8698, or log on to hotzehwc.com. We'll be right back.